Thank you, Dr. Dorothy. First, thank you for having me in this distinguished panel. Yes, indeed, self-care is an emerging trend in the health sector, and it's not an entirely new concept. As a matter of fact, we've been having self-care for a very long time. But by definition, self-care is the ability of individuals, communities, families to take care of their own health. So promoting, preventing, and coping with illness without the support, with or without the support of healthcare. The health space, particularly in reproductive health space where I work, there are examples of interventions around self-care, categorized as self-awareness. So this is the ability of the patient or the client to self-educate on matters relevant to their health. Then we have self-diagnosis. So we have quite a number of interventions under self-diagnosis, like self-testing, HIV, pregnancy test kit we are familiar with. We have self-monitor, for able to monitor your own blood pressure and also self-management. So self-management, we have examples, for example, managing using over-the-counter medications. No one really goes to be explained what to do when they have a headache. You just know, when I have a headache, I go to a chemist, I buy a painkiller. And the latest kid in the block in the reproductive health space is self-injectable contraceptives. So quite a number of other interventions, but I just wanted to highlight a few examples in the RH space. Thank you.
Thank you for that. Now we know from, even before we started this conference, there's been a lot of worry and wonder, where will the new pharmacists who are coming out, where will they go? So if we say we are empowering the public to take care of themselves, just tell us, why would it be important for that? Because we'll be wondering, are we not reducing our relevance? So why would self-care be important?
Thank you, Dr. Aywak. So self-care is increasingly becoming important, and this was really underscored during the pandemic. We know that there were restrictions to movement, and this led to barriers in accessing health services. There are some periods of time where you couldn't be able to move from one point to another to access the health services that you might require. So self-care presents a great opportunity to offer that convenience for clients to be able to access quality healthcare services for as long as they have been trained or initiated to do so. So promoting access, promoting convenience to these clients, and really making the client at the driving seat of their health needs was an eye-opening moment during the pandemic, that the health system, I think, took lessons, and many other spheres in the health system are really trying to tap into self-care within their respective cadres. Thank you.
So thank you. So we move on to just be thinking, how now will the pharmacists place themselves to be able to be the one who drives the self-care agenda? And in that case, we are expanding the whole. So I'd like to ask Dr. Kimani Bubi from FIND. So just give us an idea, when we are thinking of, FIND is quite interested in AMR, disease surveillance, and the One Health approach. Please just tell us what do we do in terms of adopting new technologies? How do we do that when we are looking at expanding the emerging trends in pharmaceutical care?
So thank you very much, Dr. Ari, for the opportunity to be here at this part of this panel. And thank you to my co-panelists. And before I start, allow me to wish my esteemed colleague and former classmate, Dr. Kagwa, happy birthday. And we say that we celebrate you today for all that you're doing at the county level and also at HOPAK. Thank you, Dr. Ai. So FIND stands for Foundation for Innovative New Diagnostics. And today is actually our birthday. We were formed 20 years ago at the World Health Assembly. As you know, the World Health Assembly is ongoing currently, and our mission is to increase access to tools, both digital and physical equipment. So to your question, I think that digital tools are key in helping us in decision making. So I'll give you an example. As FIND, we have been very keen to work on AMR, and one of the things that we have done is to develop a tool in collaboration with MOH that allows for collation and visualization of AMR data. And what we have done is, because AMR is a multi-sectoral problem, that we have brought in data from both animal health and human health. And this is available in a common dashboard. And we think that it's important to have an idea of resistance patterns, both within the hospital level, but also at the county and at the national level. And we think that this should be able to inform decision making at the hospital. So be it which molecules should we be procuring given the resistance patterns in that particular hospital. Because there's a gentleman I want to quote called Charles Babbage, who says that errors using inadequate data are much less than those with no data at all. So it would be prudent for us to try and use these digital tools to try and get data that can inform our decision making. Thank you.
Thank you for that. And when you think about getting data, a lot of the time that is tasked to AMS committees. So probably you could just give us, how will AMS teams or those who are AMS champions within their facilities, how will they be able to, how they best plug in when you're thinking about how do we get this data, or how do we get support in terms of making sure you find data that drives decision?
Thank you very much. No, I think AMS committees are critical in the decision making. I'll give an example of Makueni, which is one of the sites that we have been working at, and I'm happy that Dr. Kanyange and Dr. Gavin are around. And just to say that they have managed to have a very solid AMS committee, and interestingly, the MedSoup is the chairman of the committee. And so what that has done is that decisions that are made at that level have the support of the administration. So be it which measures should be employed at the ward level, which measures in terms of what should be procured, the kind of patient counseling that they should consider giving to the clients. So this is critical. Even as we look to see is a special opportunity for us as pharmacists to be at the core of it all in terms of the care that our clients receive. So I think AMS committees are very crucial. Thank you.
So just building on that agenda of AMS, so I'd like to ask Dr. Nkatha, what opportunities, when you're thinking AMS, you're thinking infectious diseases, what opportunities are you seeing in the pharmaceutical sector for us to be able to plug in when we're looking at infectious diseases?
Thank you for that question. And thank you, panelists, for bringing us to this point. I think there's synergy in this. So in terms of AMR space and the AMS space for pharmacists, in general, even just in infectious diseases, pharmacists sit in all levels, from design of the drug all the way to, supply, procurement, services that are offered to patients, and also post-care, also community services, outreach, also that we are, within communities. So we have a role in discovery. We know our antibiotics are dwindling in terms of their efficacy. We know we need to reserve their efficacy. So pharmacists are placed in the way of optimizing the use of antimicrobials. And we also have the role in terms of discovering new agents or ways to bypass these resistant microbes. We also have a role, as he said, around data and utilizing that data to inform decision making. So we have a role in policy. We have a role in, creating the new guidance in terms of how we use medicines, even beyond antimicrobials, just so that we are promoting also healthier living. We are promoting self-care, where we're giving alternative therapies, We also have a role around clinical research. We have a role around learning from doing. So in our clinical practices, and we'll be able to see some amazing presentations on AMS in the facilities that USID MTaPS works in, where the pharmacist-driven interventions in a multidisciplinary team. So the roles are diverse, and I think we've boxed ourselves for too long to think that, you come out of service and you either go into retail or hospital, pharmacy, or industry, but there's a lot more that pharmacists can play in the role around antimicrobial resistance, but just generally in improving patient care for all medicines. There's one critical point that we feel is lacking in the AMS space, and that's behavioral science. So understanding why do we prescribe what we prescribe, why patients request what they do, why is around prescribing antimicrobials. So behavioral change is a role around that. Thank you.
So thank you. So when we get to the round of parting shot, please be thinking, based on what you said, where do you see the future of pharmacy? So now I'd like to ask the next question to Dr. Larry Kimani. When we think about pharmacy education, the curriculum is driven at making sure that you're providing skills so that you, as a pharmacist, you can be able to provide drug information and education and offer pharmaceutical care. So just give us an idea, how are you thinking about future-proofing the training of pharmacists?
Yeah, the training of pharmacists is, training of the pharmacist of the future is going to depend on certain themes which have been in the strategic plan for FIP, hospital pharmacy sector. There are other strategic plans in FIP for other sectors, but these particular ones actually address most of the things we want to, the kind of training we want our pharmacists to have. One of the themes is procurement. The pharmacist of the future is still going to be involved in procurement. He's going to determine what quantities are going to be purchased or procured, what quality is going to be procured, from where the quantity procured is going to come from, and from what kind of logistics the whole procurement system is going to depend on to get to the user in good time. The second theme of FIP regards the training of the pharmacist of the future, the competence-based pharmacist, is on influencing the prescription. The pharmacist is going to be a member of the multidisciplinary team in the ward rounds and in treatment of patients and in review of certain other procedures carried out in the hospitals and also in other clinical settings. Now, this pharmacist of the future must be involved in formulary writing of the formulary systems, in the formulary systems at the local, regional, and national level. They must be involved in all those three levels, and they must also be in a position to influence the linking of standard treatment procedures, treatment pathways, and also treatment protocols. They must also be members of the pharmacy and therapeutics. We moved away from the committees in the FIP. We are now looking at pharmacy and therapeutic committee. So the training of the pharmacist has to include all that. The other things, the pharmacist is also going to be an administrator. So what qualities, what courses must this pharmacist take or be taught? What content must be taught for him to be a proper administrator, a well-equipped administrator? The pharmacist is also going to be to work in what we call preparation of some medicines in a hospital setting, in a community pharmacy setting, what kind of training does he need? He needs to be able to prepare quality products, and he must prepare those quality products in time, in the required time, in time for the treatment of certain patients in certain clinical settings.
Thank you. Now I'd like to finish with our birthday boy. The question will not be which birthday song we want to sing for you, but Dr. Kimani has told us how they are preparing the pharmacy for the future. And we have our other partners, Dr. Gitonga, we've had Dr. Anyona and Dr. Kinuthia telling us what it is they have in terms of support. So you sit in a position where you are having the human resources, and you see where we are thinking in terms of emerging pharmaceutical care, how to get that delivered. Could you just tell us, package for us, how you see utilizing these self-care models, building on the AMS programs? How do you see yourself, and even probably to motivate others, how can they utilize the pharmacists in those spaces, and in that way show what more can the pharmacists do than the standard?
Yes, good morning, everyone. Good afternoon, sorry. Thank you, Aywak. Thank you, my fellow panelists. I'm humbled to be part of this panel discussion on our future, on emerging trends. And thank you for the birthday wishes. So I think Anyona and Kinuthia mentioned this self-care issue. If you look at the emerging trends in healthcare, we are gravitating toward UHC. And UHC, primary healthcare, is a core component of it. And self-care, that concept came during the time of COVID. For those of us who used to run clinics then, I remember when COVID came in, we had a rise in complications, especially for patients with diabetes. Why? Because patients, they thought they had been told not to go to hospital during COVID times. There was a lot of misinformation. So the concept of self-care came in then. How do we follow up these patients in terms of even calling them and having CHV visit them? And pharmacists, because we are discussing the emerging trends in pharmaceutical care, we must, I think the discussions we had yesterday and today going forward, I think we are here to place ourselves strategically to take advantage of the forthcoming events. And UHC is something we cannot deny is coming. And primary healthcare. I remember in our HOPAK annual symposium last year in Eldoret, Dr. Sultani Matenechero talked about pharmacists venturing into public health space. And I think it's high time also we throw away the box and venture into public health. What I mean by public health, in one of the presentations that were presented yesterday by one of the young pharmacists, is about pharmacists. I think all data has shown pharmacists is the most accessible healthcare professional. So even in the primary healthcare space, we are still the most accessible. So in terms of healthcare, we are pushing for promotive and preventive healthcare. Maybe in the private, they may think we are cutting business, but okay, generally in terms of healthcare, we want to prevent diseases. So pharmacists, we must place ourselves in terms of preventive and promotive healthcare. And how can we do that? Counseling patients, talking to them. Lifestyle diseases is part of our training. I think it's something that it's an unventured space that we need to think of. About AMS, I'm also the MR focal person for Kiambu County. And it's a pandemic that is looming. It is the Kenodia, you will agree with me, it's called the silent pandemic. The data we have is that by 2050, we'll be losing like close to 10 million people out of AMR. By 2030, around 22 million households will run into poverty because of unregulated self-care. So even as we talk to them, like Anyona said, let's educate them. Just because you have a cold, don't go to a chemist and order for amoxicillin. Take care of yourself. So I think it's part of public healthcare pharmacy space to practice about self-care and USC and primary health care. So it's a field that we can venture into. Thank you.
Thank you very much. Now I'll just give each of the panelists a minute to give a parting shot. So can we start with you, Dr. Kagwa?
Please let me take water.
Okay. Let's start with Dr. Kinuthia.
All right, thank you very much, Dr. So for me, it's to invite us to seek data, good quality data. I know it's a process, but let our decisions be informed by data. Let's make good, sound decisions that are based on data. Thank you very much. And I would also like to invite KMS focal people within the different counties for a conversation to see how we can support them in this. Thank you.
What Dr. Kagwa said about us pharmacists being the most accessible professions. As a matter of fact, is the first point of contact for majority of Kenyans. So we have a unique position to support, offer guidance, education to the many clients and the many innovations that are in the pipeline, to be able to onboard them, those who are willing and able, of course, to be able to take advantage, understanding that it is actually a pathway to primary healthcare and expanding access to universal healthcare. And finally, I'd just like to point out that we'll have a session tomorrow at 9, where we'll talk about how my organization InSupply has partnered with retail pharmacies to be able to roll out self-care, self-injection in that channel. Thank you.
Hello? Yeah, so my parting shot is just to encourage us that actually the AMR space is largely needs pharmacy intervention, because when we look at it and we call ourselves medicine experts, when we're looking at a crisis, it's not even silent anymore. It's not, it's an ignored pandemic. That's what antimicrobial is. So we need pharmacists in this space. We need to look at opportunities where we are reducing the burden of use of antimicrobials, especially as we move on into universal healthcare. There's cost savings around that. There's also opportunities for outpatient parenteral and antibiotic treatments, for long-term treatments of antibiotics. So I just want to encourage that the scope, as Dr. Kagwa said, throw away the box. There's teleservices, telepharmacy, there's self-care. There's so much space that we can occupy. He spoke about public health, and that's where I sit as a public health pharmacist. So just to encourage us that we are at the center of the multidisciplinary team, and our value needs to be seen in the clinical decisions that we make and contribute to this space.
Yeah, my parting shot is that the pharmacists must be in a position, the future pharmacists must be in a position to influence prescribing. The future pharmacists must also be in a position to take part in what we call collaborative prescribing. You will be prescribers. You will be called to prescribe certain drugs for certain conditions. You must be prepared for that. And the future pharmacist must also, in addition to being an antimicrobial steward, he must also be an opioid steward. That's an area where we have not quite thought about in great detail, but we need to think about opioids. How do we shepherd the use of opioids? Thank you.
Thank you. As part of my parting shot, I want to say in the good book, I think it says, I don't remember the verse, but it says the kingdom of God has suffered violence and it is taken violently. So what I usually say for pharmacy, now we need to take our position in the public health space without being coerced into it. We must take issues into our hands, or we demand for them. So, and as my panelists have discussed here, I think from AMR, public health, UHC, prescription issues, we have a lot of forays that we have not ventured into. I was talking to Dr. Idris from the States, and he was telling me how a few pharmacists in the States ventured into MTM. And 98%, according to him, of pharmacists in the US are in the private sector. Only 2% are in the public sector, and they are being paid for their services, especially under insurance scheme in the States. So I think in Kenya, we have a lot of space to explore. Let's believe in ourselves. Let's learn from each other. I know maybe our undergraduate training may have been limited in some aspects, but we have so many forums of learning, CMEs, short courses. Let's venture into public health space. Let's venture into UHC. Especially UHC. It's a big thing that the government, I know the government has set around 77 billion into primary health care. And what are they doing? They are equipping they are no longer called CHVs, they are called CHPs, community health promoters. They are even being equipped with kits with amoxicillin for treating pneumonia at the community level. Where is the space for pharmacists in that area? Hatutapatiwa, lazima to demand kukua on that table. If you are not on the table, you are what? You are on the menu. So I think we let's believe in ourselves. Let's have mentors. Let's have benchmarking issues among our networks, HOPAK, industry, regulatory. Let's learn from each other. We take advantage. The other important thing that we are facing, pharmacists, let's get into the policy formulation aspects. I wish Dr. Murisho and the rest were here. We need pharmacists in parliament. We need pharmacists in county assemblies. We need pharmacists as a president, like yesterday. So all these areas are open for us, and it's up to take up there. But we have a lot of adventure area. For the young pharmacists, please let's not give up. Even if, like in the States, if 98% of pharmacists are not in government, if the government is no longer absorbing pharmacists directly, it's not the end of us. There are so many areas we can venture into and work and see our profession grow. Thank you so much.
So I wish to once again, we appreciate our panelists.